You're listening to Faith in Healthcare, the CMDA Matters podcast. Here's your host, Dr. Mike Chupp.
Welcome, friends. We are so glad that you're here for our second episode under our new name, Faith in Healthcare, where we explore the issues that matter most to Christian healthcare professionals. So whether you're in healthcare, married or otherwise connected to someone who is, or you're just simply interested in how God is working through Christ followers in patient care and beyond, we're so glad you're here. We are very committed to sharing the same bold stories and faithful voices from across the world of healthcare. But this name puts front and center what this podcast has always been about, faith as an integral part of our healthcare, and what happens when faith shows up in the places that matter most. In today's culture where truth is often contested and hope can feel scarce, we believe the presence of Christ in healthcare is more vital than ever, friends. Our prayer is that this new chapter helps more Christian healthcare professionals find community, as well as encouragement and purpose in the calling that they've been given. Because this community we're building together, it matters. Well, this episode today is both timely and deeply important. Vaccines have saved millions of lives across the globe, yet today they remain a source of confusion, fear, and even division, even in the church and among Christians in healthcare. With the U.S. facing its worst measles outbreak in over 30 years and a resurgence of whooping cough, this is a conversation that we simply cannot afford to ignore. As vaccine hesitancy rises and misinformation spreads online, many Christian families and healthcare professionals are left with honest questions and growing concerns. Well, to help us navigate these questions with both clarity and compassion, we're joined by one of the world's leading voices in vaccinology and public health, and he's Dr. Paul Offit, alongside a new guest co-host, Dr. Amy Givler, who's a longtime CMDA member, a current CMDA Trustee, and a family physician who has written and spoken extensively on vaccine ethics. Dr. Offit is director of the Vaccine Education Center at the Children's Hospital of Philadelphia, as well as the Maurice R. Hilleman Professor of Vaccinology and Professor of Pediatrics at the University of Philadelphia. He's co-inventor of the rotavirus vaccine, and that work has saved countless lives globally. Beyond the science, he's also been a leading advocate for truth, nuance, and empathy in public discourse around vaccines, especially in the wake of the COVID-19 pandemic. Dr. Givler brings a deeply personal and faith-rooted perspective to this conversation. She's a family physician serving in Louisiana, a cancer survivor, and author of the book, Hope in the Face of Cancer. She's very passionate about equipping her patients, peers, and communities to thoughtfully engage with complex medical issues, including the science and ethics behind immunization. Together, they'll explore how faith can inform both courage and caution in medical decision-making, why public trust has eroded, and what Christian healthcare professionals need to know right now. We're going to dive into vaccine safety, moral responsibility, and how to speak to patients and communities with both humility and conviction. Now, friends, this episode may challenge you, it may encourage you, and I believe and hope that it will sharpen your perspective. So buckle up and let's dive in. Well, I want to welcome you today to Faith in Healthcare, our relaunched 6-year-old weekly podcast from the Christian Medical and Dental Associations. And as part of that relaunch, we wanted to have some very special, very influential guests on the program in the months of August and September especially. One of those first guests that I have the privilege of welcoming today is Dr. Paul Offit, MD, who's director of the Vaccine Education Center and professor of pediatrics in the Division of Infectious Diseases at Children's Hospital of Philadelphia, which I think more affectionately is called Chupp, if I'm not mistaken. He is the Maurice R. Hilleman Professor of Vaccinology at the Perelman School of Medicine at the University of Pennsylvania. He is an internationally recognized expert in the fields of virology and immunology, and was a member of the advisory committee on immunization practices for the CDC. He's also a member of the FDA's Vaccines and Related Biological Products Advisory Committee, and has been involved in over 160 scientific papers plus, and is co-editor of the foremost vaccine text entitled Vaccines. So welcome to the program today, Dr. Offit.
Thank you so much for asking me.
And with me as co-host today is maybe CMDA's foremost writer, author, and thinker about vaccines, and one of my board members at CMDA, Dr. Amy Givler from Louisiana, family physician. And Dr. Offit, for your benefit, when I asked Dr. Givler, who I know knows tons more about vaccines than I will ever know, who should we have on the program, your name, she didn't even hesitate. Let's have Dr. Paul Offit. So Dr. Givler, welcome to be my co-host.
Thanks. So glad to be here.
Dr. Offit, you have actually written a book about bad faith, because sometimes faith causes us to choose some things regarding vaccines that may or may not be best for our kids. You have a long list of books. Amazing. Just the titles alone make me want to read every single one of those books that you have written. So I wanted to start off by appreciating the fact, after having done some research and talked with Dr. Givler, that you are not someone who gives blanket approval of all vaccines without studying them, that you carefully evaluate the pros and cons of the vaccines that come along, including rotavirus, which is where you really cut your teeth in vaccine development. What would you say, Dr. Offit, are 2 or 3 highlights of your many years in medicine, particularly regarding vaccine development?
Well, the highlight is that I was fortunate enough to be part of a team at Children's Hospital of Philadelphia that created what became the vaccine Rotatech, which is a rotavirus vaccine. Rotaviruses are a cause of fever, vomiting, and diarrhea in children. In this country, the virus causes about 70,000 hospitalizations from severe dehydration, between 20 and 60 deaths a year from severe dehydration. But in the world, it causes about 2,000 deaths a day from severe dehydration, causes about 500,000 deaths a year. It was, before there was a vaccine, the most common killer of infants and young children in the world. And so I was just lucky to be part of a team that included people like Stanley Plotkin and Fred Clark that created the strains that became that vaccine. That was a 26-year effort.
What has been the most challenging time in your career to date, and why was that the most challenging time for you personally?
That's an easy answer. The most challenging time is now. I've just never imagined that there would be such a backlash against vaccines. I think that I think at the heart of it was the COVID pandemic. I think that really unleashed what was a sort of a simmering anti-vaccine sentiment. And I think that there were sort of 2 reasons. In 2020, when the virus came into this country and was starting to kill people, hundreds of people a day, we didn't really have anything in 2020 until the end of the year. We didn't have antivirals until October. We didn't have monoclonal antibodies until November. We didn't have vaccines until December. So what did we have? All we could do was try and restrict human-to-human contact for a virus that was spreading asymptomatically, meaning anybody you came in contact with could potentially be shedding a virus that could kill you. And so what did we do? We restricted travel. We isolated, quarantined, masked, social distanced. And I think that was seen by a decent-sized segment of this population as overreach, as government overreach. That was sort of step 1. I think step 2 was the following year. We had a vaccine by December of 2020. But in 2021, if you didn't have your vaccine card, you couldn't necessarily go to your favorite bar or restaurant or sporting event or place of worship. You may be fired from your job. And that, too, was seen as massive government overreach. And I think we kind of leaned into this libertarian left hook, and we're feeling the punch now. And it's extended not only to COVID vaccines, which I think have suffered the worst in this, but I think really in some ways all vaccines.
You know, I've loved what vaccines have done for health for 40 years since I've been a physician. And I remember very early in my in my career. Actually, in my residency, I stayed up all night with a child with Hib meningitis and saved that child's life, but he had brain damage. And I just remember thinking, oh, how sad that was. And then 1 year later, while I was still a resident, the vaccine came out. And I just thought, okay, this is it. I am sold. Vaccines are the way to go because preventing disease. But unfortunately, when you prevent a disease, the parents who would be so appreciative for you of taking care of their child never knows that you had anything to do with it. And I remember, just going back one more thing on the 2020, how scary that time was. When that virus came out, I thought, is this going to wipe out the planet? Is this going to be a post-apocalyptic story? Nobody knew. We didn't know. And I just thought, oh, when a vaccine comes out, everyone will say, oh, now we understand how important vaccines are because they've saved so many lives. And somehow that didn't happen. Do you have thoughts on that?
I had the exact same thought. When that vaccine came out, I thought, this, if anything, will severely weaken the anti-vaccine movement because here it is. I mean, often people in the anti-vaccine movement would say, give me a pandemic, all right, because none of these things that we're preventing now are all that big or all that big of a deal, which was obviously wrong, but nonetheless, that was what they said. Now you had your pandemic. I mean, 7 million people in this world were killed by that virus. It dramatically lessened your risk of dying if you got this vaccine than if you didn't. And very quickly, 70% of the country by July of 2021 had been vaccinated, but 30% chose not to. And an estimate by the Kaiser Family Foundation was that about 230,000 people basically chose to lose their lives by not getting this vaccine. And you're right. I thought this will change things. And if anything, the opposite happened. So I'm as surprised as you are.
So I try to put my patients or people I'm talking to at church or in the community into 3 buckets. I'm thinking the people who just don't know, like a new parent doesn't know about vaccines, wants to ask questions, but is, definitely on the, just needs information. And then secondly, somebody has some hesitancy because of what they've read or whatever, but they're not firm on one way or another. And then third, the activist, the anti-vaccine activist, I would call. And I love this quote from April from your Beyond the Noise blog, which I recommend to people. It's a great blog. But you said, today's anti-vaccine activists are lawyer-backed, media-savvy, and extraordinarily well-funded. So I've heard you discuss vaccines with the vaccine hesitant, and I appreciate your informative and yet, sort of persistent, fair and balanced approach. But is there any value in countering the truly vaccine activist?
Well, see, I'll take a step back for a second. I do think we ask a lot of parents in this country. We ask them in the first few years of life to prevent 14 different diseases with vaccines, which during that period of time can mean as many as 25 inoculations. It can mean as many as 5 shots at one time to prevent diseases that most people don't see, using biological fluids that most people don't understand. So I would be surprised if there wasn't some pushback. And you're right. I think that the way that you categorize it into those 3 groups is exactly right. I think it's reasonable to question vaccines. I think it's reasonable to be skeptical about anything you put into your body. Ask the question, do I still need this? Do the benefits really clearly, definitively outweigh the risk? All fair questions. And that's the questions that I try and answer. But sometimes I come in contact with that third group that you mentioned, meaning the sort of anti-vaccine activists. And at their heart, in many ways, is conspiracy. They believe that there are evil forces that are acting on physicians to hide the truth, and that it's funded by the pharmaceutical industry. And in the pocket of the pharmaceutical industry is the federal government, including the CDC, or the Advisory Committee for Immunization Practices, or the FDA Vaccine Advisory Committee, and doctors. And so it's trying to convince somebody that they're not a conspiracy theorist is hard. I mean, there's an old joke, hopefully I'm allowed to say it on this program, but there's an old joke where a conspiracy theorist dies, goes to heaven, and he sees God, and God says, you can ask me one question and I'll give you an answer, and that's it. So the conspiracy theorist said, who killed John F. Kennedy? And God says, well, it was Lee Harvey Oswald, and he acted alone. And the conspiracy theorist shakes his head and goes, wow, I didn't realize how high this went.
Yeah. So when I have patients who come in and spout a conspiracy theory, which does happen, I practice in Louisiana, even though right now I'm in Rhode Island, I practice in Louisiana, and there's unfortunately a lot of them. I try to disarm them with humor and say, well, I know you're not thinking about, you're not a conspiracy theorist. And so then they smile, but it just try to have them look at what they're believing a little more carefully.
It's hard. And so I try the best I can, but it becomes very clear very early sometimes that it's just not worth the continued discussion. And I'll say that. I'll say, is there anything I could possibly say to you that would sort of change your point of view or modify your point of view? And if the answer is no, then why are we still talking?
Yeah.
Well, Dr. Offit, we have close to 1,000 of our members, constituents who serve around the globe. I'm one of them, former missionary in the country of Kenya, and just saw the benefit of the Kenya government-initiated program from 1980 called KEPI. And, one of the disadvantages, I think I've read in something that you wrote, that vaccines have become maybe victims of their own success, that over time, without these diseases, it seems like it's no big deal. But I think the advantage maybe, I put that in quotes, the advantage of the developing world, majority world, is that it hasn't been that long ago when pertussis, diphtheria, lots of tetanus was around. And at the hospital called Tenwick Hospital, where I was for 20 years, early days, some whooping cough, but then gone by the end of my time. And just, it was so clear the results of the KEPI mobilization of vaccines. I'm also on an international board for the 107 nations that belong to associations like ours at CMDA US. And when I go to board meetings, especially during COVID and immediately after the pandemic, the shaking of the head and not understanding of the other leaders from around the world of we Americans and our vaccine hesitancy pushback that we've been talking about. What has been your experience? Because you're an international player, influence, researcher, what has been you seen in terms of leaders from other countries and the perspective on vaccine hesitancy?
I think you sort of put your finger on the heart of it. You have a measles outbreak right now. Now, we eliminated measles from this country by the year 2000. Now, hundreds of thousands, millions of cases still occur from measles in the world. There's about 150,000 deaths from measles every year in the world. And so in many areas of the world where measles is still fairly common, it's not that hard to get people vaccinated, other than, say, the fact that they're in a war-torn community and it's hard to get them vaccinated. But I think it's not only in this country that we largely eliminated measles, we eliminated the memory of measles. I think people don't remember how sick that virus can make you. I mean, I'm a child of the 1950s, the early 1950s. So like all children who were born in the early 1950s, I had measles. And at that time, before there was a vaccine in 1963, every year there would be about 3 to 4 million cases of measles in this country. There would be 48,000 children hospitalized with pneumonia, severe dehydration, or less commonly encephalitis, inflammation of the brain. A quarter of whom who had encephalitis would be left permanently blind or deaf. And then there was a consequence, and I've seen 5 of these cases, and you know what I'm about to say. The chronic measles infection of the brain, child gets measles, recovers, then 5, 7, 10 years later, because of this chronic measles of the infection of the brain that has the long name subacute sclerosing panencephalitis, has a gradual deterioration in handwriting, a gradual deterioration in personality, and then ultimately sort of devolves into this vegetative state from which there is no escape, and ultimately they die. I've seen 5 of those cases. There's nothing you can do other than stand back. The only thing you could have done was prevent it with a vaccine. But I think vaccines, as you note, are a victim of their own success. I mean, my children, not surprisingly, are fully vaccinated. But did I ever imagine they would really get any of those diseases? No, sort of too horrible to imagine. And I think we live in this sort of state of blissful ignorance that we're invulnerable. But when we're not, and it's interesting when you talk to some of these parent advocacy groups, meaning that advocate for vaccines, like Families Fighting Flu or Meningitis Angels or National Meningitis Association. Those parents all tell the same story. They say, I can't believe this happened to me, until it happens to you. And then they just courageously feel, okay, I was put on this earth for a reason. And my child has suffered or died from this infection. And so I'm going to convince people about how important this vaccine is and how deadly this disease can be. And God bless them. I mean, for me, were I to lose a child, I would just curl up and hide under my desk and never leave my house. But they see this as a calling.
Yeah. Well, you don't know. I mean, God might give you grace to be able to be an advocate for whatever. You never know what resources you have until the time comes for you to use them. Yeah. But just bringing us back to the States, and especially the South, which is where I practice medicine, just that there's such a tension between public health and the needs of public health and the individual needs of patients. And there's just a strong sort of idea of, nobody tells me what to do, especially in the South. And America is very strong on personal autonomy, and I get to do whatever it is I want. Everyone else, they can take care of themselves, if not. Sort of survival of the fittest, Whereas public health has a different view. Public health is sort of like we're all in this together, we're in a community. So how does that get balanced, that the needs of public health and personal autonomy?
I feel like I'm talking to myself. I completely agree. I said the same. That's the tension. The tension is between public health, which means caring about your neighbor, and medical freedom, which means the freedom to do what you want, in some ways independent of how it affects your neighbor. I remember there was one moment in California. There was an outbreak in California of measles between 2014 and 2015. And then it spread to 25 other states. It involved several hundred people before it finally settled down. And it spread actually into Canada and Mexico. So it was really a sort of a left-leaning, liberal, community that was the center of that outbreak. And that was it, freedom to do what I want to do. And so Richard Pan, who was a state senator in California at the time, introduced something called Senate Bill 277, which would eliminate the philosophical exemption to vaccination in a state that didn't have a religious exemption to vaccination. Therefore, were he successful, and he was, you would only have medical exemptions in that state, period. And so the anti-vaccine movement was up in arms, and they were there at every meeting where this was open to the public and decrying that decision. His name was Rhett Krawitt, Krawitt. He would go to those meetings occasionally. He was little, so they would have to put him on a stool so he could reach the microphone. And he said, my name is Rhett Krawitt. I have leukemia. I can't be vaccinated. I depend on you to protect me. Don't I count? See, to me, he was the voice of society. Because what you're saying when you're saying under the sort of general term, euphemistic term, medical freedom, it's my freedom to catch and transmit a potentially fatal infection during a pandemic. And I mean, if you step on a rusty nail and you cut your foot and you don't want to get a tetanus vaccine, no one's going to catch tetanus from you. It's not a contagious disease. But measles and many of these are. I mean, is that your right to expose the person you get onto a bus with or you get on an elevator with, knowing that some of them may not be able to be vaccinated? And I think it's a certain selfishness that somehow is championed.
Before we continue with this week's episode, here's a special announcement for you. Fall is full of upcoming 2025 CMDA conferences. The Women Physicians and Dentists in Christ Commission will be holding their annual conference September 4th through 7th, 2025 in Albuquerque, New Mexico at the beautiful Hotel Albuquerque, right in the heart of Old Town and the Rising Sawmill District. This conference is one of the very best ways to experience the belonging, support, and equipping that is at the heart of the WPDC ministry. CME is available, and we invite you to explore all the conference details and register today at wpdc.cmda.org. The 2025 Midwest Fall Conference is happening September 26th through 28th at the Maranatha Retreat Center on the shores of Lake Michigan. This gathering features speakers like Dr. Far Curlin, Dr. Stephen Coe, and a special panel with Dr. Carl Truman. You can earn up to 6 CME credits, and there's a full children's program for kids 12 and under, making it a wonderful weekend for individuals or the whole family. Join us for the 2025 Northeast Regional Retreat, October 24th through 26th at Sandy Cove Ministries in Northeast Maryland. This year's theme is Faith Embodied, led by Dr. Stephen Coe, a pediatrician and preventative medicine physician at Mass General Brigham in Boston. Continuing education credit is available. First-time attendees can also find an additional discount code on the event page. Learn more about all of these events and register at cmda.org/events. Let's jump right back into this week's episode.
Well, Dr. Offit, as I mentioned, our new name for our podcast is Faith in Healthcare. And clearly, our constituents, CMDA, our leadership, all of our board, our House of Representatives are interested in having good faith in good health care. And we have plenty of instruction from our Lord Jesus Christ, as well as the Apostle Paul. Apostle Paul wrote, "Nobody should look out after his own interests, but the interests of others." And of course, Jesus, the golden rule, do unto others as you would have them do unto you. And so good faith should be thinking of others, as we've alluded to earlier. I'm not sure that the public looks at necessarily the church and Christians in general right now in America and says that that's what the Christian faith is about. What has been your experience in terms of a public view of faith, in particular the Christian faith, when it comes to vaccines and public health issues that looking out for the interests of others?
I think in some ways all religions teach you to care about your family, care about your children, care about your neighbor. I mean, to me, I'm not in any sense like a religious scholar, certainly true, but I mean, the sort of the three most important words in the Bible were love the stranger. And I think that's true. And in some ways, it's hard for me to watch some of the things that are going on now where people in the name of religion do exactly the opposite of that. It's been a little hard, but I think that at the heart of all this is caring about those around you. And I think things have changed. I do. I think 50 years, there's a film called The Polio Crusade by Sarah Colt Productions out of Boston, Harvard. But if it's a movie that has a lot of voices from the polio era. And when you hear those people talking, it's very different than what you hear today. You think my polio was bad. You've just seen what happened to Joe over here. And maybe it's because we were just coming off the shared national tragedy of World War II, where we saw polio for what it was, which was a shared national tragedy that we contributed our dimes to in the March of Dimes and created a vaccine. But it's different today. I just think there was a moment with 9/11 where we all hugged each other and saw ourselves as part of a shared tragedy. But I feel we've devolved into this divisiveness where you're just this tribalism that does not serve society well.
Just also, I was hoping to have you weigh in on the idea. The tone of it was, we know all about this virus, and we are about to tell you exactly how to protect yourself from it. And if you get these 2 vaccines, whatever, if you get these 2 shots, you're protected forever. Certainly protected you, but not from getting the virus again. And so there was just sort of a tone, almost bombastic, sort of, we know more than we do. And I remember hearing you very early on saying, hey, wait a minute, we actually don't know that. We've got to study that. That's going to probably be about 5 years before we know the answer to that question. Looking for evidence-based, not just what we hope to be true. And I really appreciate that humility. But I think, especially in the South, my patients felt like, we talked about government overreach, in this way too, where it was sort of, here's this medical authority saying something, and then 6 months later, oh, no, we were wrong. Well, actually not we were wrong, but here is the thing now. And then if you compare it, it's different. So I know that you tried to warn people, but what would you do anything differently now?
First of all, you're exactly right. I think that in those, especially the first few years, we came off as a little dictatorial. Do this because we follow the science. And I think what we didn't explain well was you learn as you go. You don't know everything at the beginning, and you have to be open-minded to that. I think that, for example, when this was like in February 2022, there was a meeting between myself and three other sort of virology, immunology types, and then Dr. Fauci, Dr. Collins, who was the head of NIH, Dr. Walensky, who was the head of CDC, and Vivek Murthy, who was the Surgeon General. And at issue was, should natural infection count as a vaccine? In many ways, you could argue when you're naturally infected, you'll make an immune response to all four viral proteins. When you're vaccinated, you'll make an immune response to one of the viral proteins. There was every reason to believe that natural infection would prevent the at least severe disease associated with re-exposure. That conversation should have happened in public. It should have been for all to hear that discussion, and a lot of these discussions should have been in public. I think that this recommendation, which we are going to get away from, of having a yearly vaccine for everyone over 6 months of age, is really at variance with what virtually every other country in this world is doing, which is target high-risk groups, those most likely to be severely ill. But the biggest mistake we made was this is a short incubation period mucosal infection, like respiratory syncytial virus, like rotavirus, like influenza virus. You're not going to be protected against mild to moderate disease for long. You'll be protected for about 6 months after a natural infection or immunization. And there's every reason to have known that then, knowing what we know about short incubation period mucosal infections. By incubation period, I mean from the time that you're exposed to when you develop symptoms. You knew that wasn't going to last. But what happened was, in 2021, when you just had a vaccine, you were 12 times more likely to be hospitalized and die if you weren't vaccinated than if you were. And so I think there was a pressure in some ways to overpromise that vaccine. So look, if you get this vaccine, you're going to dramatically decrease transmission, which wasn't true. You would decrease it somewhat, but certainly not eliminate transmission. You would, that you weren't going to, you would certainly clearly lessen your incidence of mild to moderate disease for about 6 months, but not much after that. And you would certainly dramatically decrease your chance of being hospitalized or die, but not eliminate it. And I think what happened was people would get vaccinated because they believed they were forced to. Then they would have a moderate illness 6 months later, 8 months later. You're home. You have fever, you have chills, you have coughing, you're thinking, these people made me get this vaccine and now I'm still sick. They lied to me. Mm-hmm. And I just think we should have reduced expectations or been more honest about what you could reasonably expect. And we didn't do that because we really wanted to make sure people got vaccinated because the hospitals were overwhelmed. I mean, I work at a children's hospital, not an adult hospital where, it's you're much worse off if you're, say, over 75 with this illness. But we had 3 floors of COVID. We had nurses wearing bandanas for masks and garbage bags for gowns. And we canceled elective surgeries. And we were making hard decisions about who could or couldn't come into the ICU. And so you could see where the tendency was to dramatically promote vaccination at some level and oversell it. And I think we suffered that.
Dr. Offit, as a follow-up question, I still am in meetings, both U.S. and international, where I hear people making statements like, well, there really, at the end of the day, when we look back, there was no difference in hospitalizations and severe COVID. And I shake my head because it seems to me, at least my perspective, is that there was a huge difference, and you've alluded to it several times, a huge difference in severe COVID incidents and deaths, ICU, respiratory, ventilators, the whole 9 yards. You say that's absolutely not debatable anymore, that you're convinced that the vaccines did so. Because I can't believe I keep hearing people say, oh, no, it's really a cover-up. That's not really true if you look at the data.
So the vaccine probably saved 3 million lives. Is the estimate. You were 12 times more likely to be hospitalized in 2021 if you were unvaccinated and die. In 2022, now you're seeing a lot more natural immunity. It was about 6-fold. You were about 6 times more likely to be hospitalized and die in 2022 if you weren't vaccinated than if you were. Now, because there's so much natural infection, virtually everybody's been vaccinated or naturally infected or both, things are more moderate. But certainly if you're in a high-risk group, which is to say if you're immune compromised or you're over 75, where you have chronic medical conditions like chronic heart disease or chronic lung disease, if you're pregnant, you are more likely to be hospitalized than someone who's not in a high-risk group, and therefore you should be vaccinated. But you're right. I just think we're living in a time that's frightening. I think we're living in a time of science denialism. That it's not just skepticism, it's denialism, where people are just declaring their own truths, including scientific truths.
Right. And if you can say it convincingly, then
you'll get followers. You get followers.
I remember just as an aside, I remember when I was posting on Facebook every week or two, all the first several years of the pandemic. And I remember when it came out, oh, well, the vaccine decreases fertility or, makes you infertile. And it was so ridiculous that I didn't reply to it. And people were writing me saying, you need to reply to this. And I think somebody just made that up. That is so absurd. I can't even think about it. But of course, it did take, root and was spread around. And the trouble with science, the scientific method, is it takes long amount of time. You have to, you want evidence-based, so you have to set up a study. And whereas if you want to make up something, you can do it in 20 minutes and 1 million people can see it, an hour later.
No, that's so true. In 2009, we had a swine flu pandemic. The head of the CDC at the time was Richard Besser. He was great. He was out in front of the public, or said another way, in front of the media, and therefore answering the public's question every other day. Here's how this vaccine is made. Here's how you can get it. Here's how it works. Here's what's happening with the disease. Here are the problem areas. It was a model in how to do it. And so I saw him at a recent meeting, and I went up to him and I said that. Richard, I think you were great. You were a model for how to do that. He said, thank you very much. I could never do it today.
I guess the sort of my last big thought that I'd love you to weigh in on is how we as physicians and healthcare professionals don't have experience with these diseases. I mean, I personally had measles when I was a kid and remember it, and had mumps and chicken pox and remember being miserable. But, doctors today don't see it, and I'm glad they don't see it. But how can we open eyes of health professionals to diseases that we want to have remain in our rearview mirror?
First of all, I had you down as a child of the 70s, so you definitely.
Oh, no. But born in 58.
So that's the question. I wrote a book about a man named Maurice Hilleman, who I think in many ways is the father of modern vaccines. He did the primary research or development on 9 of the 14 vaccines we currently give to children. And so he was diagnosed with disseminated adenocarcinoma in 2004. October 2004, he was given roughly 6 months to live, and that's how long he lived. He died in April of 2005. So in that last 6 months of his life, I interviewed him extensively because he was just this amazing guy who had been a hero for me for a couple decades. And so here he's the inventor of the measles vaccine. He's the so-called Morton strain of measles vaccine, which came out in 1968. That's his vaccine. So now it's 2004, right? Because of that Andrew Wakefield paper that was published in 1998, falsely claiming that the measles, mumps, rubella vaccine caused autism, you were starting to see a fraying of immunization rates. And now you're starting to see measles come back, even though we'd eliminated it by 2000. And I remember asking him that question at the time. Here's what we're trying to do. We're trying to educate people about this vaccine, educate them about this disease so that they don't have to suffer it again. Will that work? Or do we have to once again see these diseases come back in order for people to realize the importance of the vaccine? Now, this guy devoted his life to trying to save the lives of children. And he spent a long time answering that question. He sort of looked at this. I remember it was suburban Philadelphia, wintry day, January. He's looking out his back window. And then he turns back to me and he said, no, I think the diseases are going to have to come back for people to realize how important these vaccines are. And he was very sad when he gave that answer.
I was able to watch a Medscape video that you did with 3 others just in the last month. On a paper, clinicians must do the work to combat vaccine hesitancy. And you had a lot of practical suggestions there in that article and in the interview that I saw online, that it does take work, but we need to respect the whole idea of vaccine hesitancy. There's really good reasons for parents. I think we were talking about that earlier on in this interview. So I want to have our listeners go to Medscape if they would like to see that wonderful interview. I wanted to ask a question that's burning in this non-primary care surgeon's mind, because I get lots of email from our constituents about various things, especially regarding the COVID vaccine. I get the AMA. I'm a member of the AMA, and I get their morning report, morning round stories. And one that was just 3 weeks ago, updated COVID-19 vaccines are effective against new coronavirus strains. So I just wanted to get it from the top, from a reliable source, Paul Offit. Where do things stand? What are your recommendations? What do you think is the best science right now for COVID vaccines? Who should get it and when? if you wouldn't mind sharing that.
Right. So we keep waiting for this vaccine to settle into a winter pattern, which is true of sort of the other 4 strains of human coronavirus that circulate.
You mean virus, this virus?
Yeah, I'm sorry. So we keep waiting for this SARS-CoV-2 to settle into a winter pattern, as is true of the other sort of 4 strains of human coronavirus that have been circulating for, in some cases, 2 centuries. And it really hasn't. I mean, it's still, it's still, I think, tends to come up more in the winter, but still it can circulate for the most part year round. I still think the best time to get it is October, November, before the winter season. And I think those who should get it are those we listed previously in this podcast. The highest risk groups are the ones who should get it. And it's not, the virus continues to drift. We went from Alpha to Delta to Omicron, although we're still in the Omicron era. We've never gone past the Omicron era. I keep waiting for a newspaper article to say, where is pi? But, it's just, we're still in the Omicron era. And I do think whenever we talk about it, even at our FDA Vaccine Advisory Committee, we're always talking about antibodies that bind to that part of the virus spike protein, the so-called receptor binding domain that attaches to cells. And that's where the virus sort of drifts. But that's not the only part of your immune system that protects you. The other part of your immune system that protects you are T cells, especially cytotoxic T cells, which recognize more conserved regions that are shared. So you're still largely prevented from serious disease, even if we don't get the vaccine strain exactly right, because it's always moving. So you pick a strain like in June, 3-month production cycle comes out in September, and then by the end of like the year, November, December, it's already to some extent mutated to some extent away from that, but you're still relatively protected against severe disease, which is what you care about. You're just trying to stay out of the hospital, stay out of the intensive care unit, and stay out of the morgue. There's an immunologist at Harvard named Dan Baruch who says, and I think he is exactly right, that cytotoxic T cells are the unsung hero of this pandemic. I think that's true. We often focus on, should we use JN1 or LP, 8.1? I mean, are we missing? You don't miss by much, is my point.
I've learned a lot through this, which I really appreciate, especially I've been sort of pushing vaccines and not really counting people's natural infection. But I think I'm going to be doing that more, which I think will be a kindness to my patients. I appreciate that. And I'm going to watch the different shows that you mentioned too.
And Dr. Offit, at CMDA, we were gently, while we were writing letters to HHS, to the government, not to mandate the population, not to have government mandates that everyone has to get vaccinated. On the other hand, we were promoting, encouraging people to get vaccinated. But when it came to children, myself and my vice president of public policy and bioethics, we just had a real hesitation in children. So, I'm looking at 2 doctors who take care of kids right now. Are there kids who should be vaccinated at this point in time for COVID?
First of all, I think the virus is continuing to circulate. When you're 6 months of age, at 6 months of age and beyond, you are fully susceptible to this virus. And so then the question becomes, is this still an important disease in children? Yes. Fiona Havers presented data in April of this year to the CDC where she said the following. There's probably about 10,000 hospitalizations every year in children meaning people less than 18. Most of those occur in children less than 4. About half are previously healthy. About 1 in 5 will go to the intensive care unit. And over the past year, 152 children died from COVID. Half previously healthy. So should you get a primary vaccine? Absolutely. And unfortunately, the immunization rate in children less than 5 in this country is only about 5%. I think that what happened recently, I know we're going to stay away from politics, but what happened recently is the Secretary of Health and Human Services stood up and in a 1-minute video on X said that HHS is no longer recommending the COVID vaccine for healthy young children. That is directly opposed to the American Academy of Pediatrics recommendation, which has again reaffirmed the fact this vaccine should be given to children who have never had a vaccine as a primary series. And I worry that immunization rates are going to even decline further. Children, this virus is still around. It can still affect children. Obviously, children are not nearly in a risk category as, say, someone over 75, but they're at risk. And if you can prevent it safely, and you can with this vaccine, then prevent it.
Well, among the numerous awards on your list that's available in your bio that our listeners can take a look at online, that you got an award for being a mentor to young researchers and scientists. And at CMDA, a very top priority of ours that we want to be very active in the grassroots, mentoring the next generation, to be active in integrating good faith into good healthcare. So I'm going to thank you for that investment and for remaining engaged. And I hope we want any good scientist who's willing to admit when things weren't done right. We need those kinds of examples around. And I think that's the bad part when medicine gets influenced by politics, because politicians can't afford to say they were wrong because we punish them for that. But we as scientists, medical scientists, good clinicians, we have to be willing to admit when we've made mistakes and we didn't get it right. So Dr. Givler told me before we got going that she hopes she's long gone before the next pandemic comes along. What are the best predictions for when the next pandemic will come along so Dr. Givler is aware?
Well, so you had a SARS-1 pandemic in 2002, 2003. You had a MERS pandemic in 2012. You've had SARS-CoV-2 in 2019. That's 3 pandemics in the last 20 years. I think Dr. Givler is going to be alive for the next one.
Sorry, Amy, for that news, but we want you to hang around for a while. So, Dr. Offit, it has been a true delight to have you on Faith in Healthcare today, and I hope we'll get you back again sometime.
Yeah.
That would be great. Thank you.
Thank you so much.
Dr. Offit reminded us today that science, it's always growing, and so must our humility, as well as our courage and our compassion. As believers in healthcare, we're called to stand in the tension between truth and trust, between knowledge and kindness, between autonomy and community. And in the midst of growing division, we've got to ask, how can we embody the love of Christ when addressing our patients' fears? How can we steward our influence to advocate not just for what is medically sound and legal, but also what is morally right? We're grateful to Dr. Offit for joining us today and to Dr. Givler for co-hosting this important conversation. If today's episode challenged you or gave you new perspective, would you consider sharing it with a colleague, with a student, or even someone in your church? It's one of the simplest ways to help us grow this podcast and reach more Christian healthcare professionals who are looking for encouragement and clarity in a complex world. To learn more about Dr. Offit and Dr. Givler's work, just view our show notes today. And to learn more about the wide range of resources we offer at CMDA to support you in your calling. One of those resources that is ready to reboot is the CMDA Point blog. If you followed the Point blog in the past, you know that it has been a space for thoughtful, faith-driven reflections on medicine and meaning. Well, now we're excited to point out to you in the next chapter that the Point of Medicine is a new forum where the conversation continues and will go even deeper. The Point of Medicine is taking the place of the Point blog, expanding from a traditional blog post to a vibrant forum for discussion among Christian healthcare professionals. It's a place to engage with others who see medicine not just as a profession, but as a calling, one that honors God and wrestles with real questions while seeking truth with humility and purpose. So beginning August 19th, you'll find the first such article, which just happens to be written by my co-host today, Dr. Amy Givler. And it's a follow-up to today's conversation on vaccine science with Dr. Paul Offit. You can just go to cmda.org/point to catch up with new articles for discussion weekly. Well, next week on Faith in Healthcare, I'll be joined by Dr. Nigel Cameron. He's a theologian, bioethicist, and author of Dr. Coop, The Many Lives of the Surgeon General. Together, we're going to explore the remarkable life and legacy of Dr. C. Everett, also known as Chick Coop. From revolutionizing pediatric surgery to confronting national crises like AIDS, tobacco, and abortion with courage and conviction. Drawing on years of research and hundreds of interviews, Dr. Cameron paints a vivid portrait of a man whose faith helped shape the course of American medicine as well as public health. Plus, there's a very special cameo that you won't want to miss from a longtime friend and leader at CMDA whose life was impacted in a major way by Dr. Coop. Thanks for listening to Faith in Healthcare, the weekly podcast from CMDA, where our mission remains the same, bringing the hope and healing of Christ to the world through committed Christ followers in healthcare. That's what matters to CMDA. Friends, as we step into this new chapter, our prayer is that each episode reminds you that you're not alone, that your faith, it matters, that your work matters. And together, we're all part of something that is so much bigger. May you recognize this week that the Lord is with you and that He is for you to do His good work. Thanks for listening, and we'll see you next time, Lord willing, on Faith in Healthcare.
Thanks for listening to Faith in Healthcare, the CMDA Matters podcast. If you would like to suggest a future guest or share a comment with us, please email cmdamatters@cmda.org. And if you like the podcast, be sure to give us a 5-star rating and share it on your favorite social media platform. This podcast has been a production of Christian Medical and Dental Associations. The opinions expressed by guests on this podcast are not necessarily endorsed by Christian Medical and Dental Associations. CMDA is a nonpartisan organization that does not endorse political parties or candidates for public office. The views expressed on this podcast reflect judgments regarding principles and values held by CMDA and its members and are not intended to imply endorsement of any political party or candidate.